Hello and welcome to the second webinar hosted by the Cost of Living Crisis Project team at One Voice Wales. I'm Angela Oakes and I'm joined by my colleagues today, Emma Good and Vanessa Owens. I just wanted to mention that as this is a webinar, the format is slightly different to a normal online meeting. You will most probably notice that your camera and your microphone have been disabled, as the focus will primarily be on today's presenters. However, please do feel free to ask any questions in the Q&A chat and we will answer them during the Q&A sessions. So today we will be exploring the help and support that's available for communities across Wales facing community transport issues, and to highlight the success stories of councils that have implemented effective transport links for their communities. Community transport is absolutely vital in Wales, particularly for individuals who struggle with access to conventional public transport. These services, of course, are crucial for their well-being and connectivity of various groups, including the elderly, the disabled, and residents in rural areas. The challenges arising from a lack of community transport can often further add to the issues associated with the cost of living crisis. Research from the Wales Centre for Public Policy, the WCPP, indicates that around a quarter of the rural population in Wales experiences some sort of transport-related poverty and social isolation. And for these individuals, transport is essential for gaining independence, enjoying a good quality of life, and achieving overall well-being. But due to geographical and population factors, rural transport solutions often rely on subsidies from public funding grants, or volunteer efforts. However, with ongoing reductions in public sector budgets, we frequently hear about services being withdrawn or reduced. And this lack of public transport options and the high cost of private travel create a crisis for rural communities, leading to what is known as poverty of access. So our recent study, which we conducted in November, revealed that many councils identified community transport as a critical concern in their area. And as a result, community transport has become one of the 6 key themes that our Cost of Living Crisis project will be addressing. We'll be providing further help, advice, training, and resources. So we're pleased today to have 3 guest speakers join us. We have Emma Bingham from the Community Transport Association, Rod Bowen from Dolen Teifi, and David Bartholamew from Llanfair, Clydogau and Cellan Community Council, who will share how his council has successfully established a community bus for their area. So we hope you find this webinar useful. Please do feel free to ask any questions in the Q&A chat on your screen. And thank you for joining us today. So with that, I'll hand you over now to Emma Bingham from the CTA.
I've entitled this No One Left Behind because it has been the theme of our conference this year, and it is the theme for CTA Wales this year, that we believe that in our communities, no one should be left behind with regards to transport. The Community Transport Association are a UK charity. We have a large membership body and we support organisations, groups, communities that deliver transport in the community. They're all not-for-profits. And in Wales, we have around 100 members. Some of those are very small community cars schemes, and some of those are larger organisations with multi-minibuses providing a range of services. Many are core funded, but many are grant funded from groups like the Lottery, etc. The Levelling Up Fund recently has been a very successful fund for many of our operators. And sometimes at CTA, we deliver specific funding for projects, such as the Western Valleys project, which enabled operators to have electric vehicles in a certain geographic area. I'm often asked, what is community transport? It's quite niche, if I'm honest. But community transport, excuse me, is a flexible, supportive transport for those that cannot access the public transport network due to location, health, disability, or income. And income is certainly becoming a greater barrier to transport in our communities in Wales, as the cost of living has meant that people just cannot afford a car. Often people need a bit more support with their transport, so they need a driver that will help them to get in and out of the vehicle, will be there to talk to them, provide additional support and care while they go on their journeys. It's not just for older people, although it often is thought that it is, but we do work with younger people and families. And it's really important that we acknowledge that lack of transport does not just affect the elderly, it definitely affects the younger people in our communities to access education and leisure opportunities. And it's more than door to door. It's a supportive, caring service that's circular in its approach. It's not A to B. It provides so much more. All our operators are immersed in the communities that they served. They understand them, and they really care deeply that everyone has access to the things that they need to access and the things that give them joy. Most importantly, what we offer is transport with dignity, and it is respectful. Across Wales, community transport is different, and we'll see that today in speaking to Rod and Dave. But it was estimated in some work we did last year, which I think is conservative, if I'm honest, but 750,000 journeys were made by community transport in Wales last year, which is a massive number of passengers to be transporting outside of the public transport network. And we see that with community cars, minibuses for group hire, dial-a-ride, so demand responsive transport, wheels to work, which is particularly important for those aged 16 and above who may not be able to afford to drive yet. We've had particular success recently with e-bikes, and they have been new in the CT sector, but definitely support health and well-being. And we also have volunteers driving their own cars, so volunteer-led community solutions. We also in Wales have 2 flexi services in community transport hands, which is incredibly innovative, and they have been incredibly successful. And it is something that we would like to see more operators have the opportunity to be part of. So when you're thinking about your communities and the transport that you think that they need, you need to consider, what does good community transport look like? And at its absolute basics, it responds to the needs of your community, and that will be different for each of you. It's flexible and inclusive, so it is open to all. It's established through co-production, so everyone is involved in the thinking about how it would work and putting it into practice. It's supportive and caring, and it looks to always improve the well-being of the individuals in your communities and the communities as a whole. So, for example, a community that cannot get people into shops or leisure centres or libraries, they do not thrive. So if we can provide access through community transport, we see economic uplift in communities as well. And community transport needs to be professional and well funded. Professional, it is always. We have a thriving and professional sector. Well funded is a more tricky situation. And I'm sure that you're all aware that funding is always something that can be difficult to find and deliver. So really, what I'm asking of you is to think about what community action you could do if you feel that transport is an issue in your community. And the first step is to identify what the issues are. What is the need? Is it a need for people to get to work? Is it a need for well-being and leisure? Is it a need for families and young people? Is it a mixture? You know, is it all of those things? And your community represents all of those demographics. Community engagement. How are you going to do this? The people with the loudest voices will always speak up, but it is often the people who you do not hear from who are the people most in need. So how do you access that group of people? And who can support you? Who is around you in your communities that you can go to for support? Are there other third sector organisations? Are there other community transport organisations? You know, are there councillors that perhaps haven't engaged with you before? CTA, community connectors? Who is there? The CVSs. You know, ensuring you hear from everyone can be really hard, and it's not something that's easy. But I really implore you to look at who you are not hearing from and create local networks. Create networks that work for you, that have an understanding of what the issues are and can add additional support and resources to the work that you want to do. Who is an expert in the things that you might need as part of the process of identifying the needs in your community? I mean, this isn't just about community transport. This is about anything that your community might need, really. Is thinking about these things. How do you get the community to act? And how do you support that action in a way that you can see results? They may not always be what you expect. Sometimes they can be negative. But that is all part of the process, really. So I've got some examples from across Wales of where we are working or have worked with community councils. It can be a slow process. So about 2 years ago, I noticed in a newspaper that Cardigan town councillors were complaining about lack of transport. So I went and saw them. I went to a meeting and we thought about what we could do. And I involved a local organisation, Green Dragon. Rod also has some services in Cardigan as well, as does RVS. And the town council were supportive, and they enabled us to have letters of support, and the mayor gave letters of support. And ultimately, we put together with Green Dragon a lottery bid. It took us a while, I won't lie, it was quite a long process. But we have now got a minibus and a wellbeing car sited in Cardigan. The project was based around wellbeing, so we didn't particularly want it to be for just health journeys, because the councillors had identified from the people that they spoke to that there were additional needs, such as transport to care homes. So the care home was outside of the town and relatives couldn't get in to visit the care home, and the bus didn't go. So the whole idea was that it was a well-being vehicle that could be used for the health centre, but it could also be used for those other trips that provided joy and well-being to people. And that could be walking groups, swimming, you know, chair aerobics, anything that was required around the well-being. So Penturk and the health centre. This is where it can be tricky. So in Penturk, the health centre is being moved. It's being moved 2 miles out of the village. As you can imagine, the village are not very happy about it at all. And I was asked by the health board to come in and work with the different groups in the village to see what options would be available to them for transport to the new centre. Earlier on, I talked about engagement, and this is a real lesson in where engagement can be really hard when you have different groups within an area that have different ideas about what they want and different ideas about what will work. And sometimes bringing them together can be quite tricky. It needs negotiation and it needs time to let people have the space to think about what is happening. This process is ongoing. The health centre has not been built yet. But it was interesting that one of the things that came up as part of this process was that no one in the community or the community council had considered asking for an active travel route between the village and the new health centre. So it's not always about a community transport solution, but something like an active travel route would have enabled some patients to cycle or walk to the new health centre in safety. But at the moment, it's a single track rural road, and that just isn't possible. So we explored volunteer-led car schemes and a community car that may come from Cardiff Council. You know, the issues that have been highlighted around that have been considerable around volunteers. How do they actually enable people who've got an appointment, who've rung for an appointment at 8 and have it at 9:10? How do they facilitate those journeys? There's lots to think about. But it's a proactive and supportive framework that we're working in to make sure that we work with everybody. But it can be tricky. So Newport Pembrokeshire is it's very, very early days, but I wanted to put it in to show you that we work right from the beginning. So there are different groups in Newport and the community council, and they really need a community vehicle. And in the past, they haven't quite come together, and they needed a facilitator that could bring them all together to have these conversations and work out what would work. So that's where we are now. We think that we have a vehicle that we might be able to get for them. And with the support of the community council and the different groups working together, we can enable and ensure that that vehicle is used every day for different things that are going on in the village. So there's lots of things going on at the village hall, transport to the health centre, and also shopping and things if it is needed. It will be an electric vehicle, I think, if we can. But it's very much grassroots, and all of these have been grassroots. And that's where you as councils and community councillors sit. You sit in that grassroots space. You understand your communities. Now, Dinas Power's voluntary concern was interesting. This was a health centre as well. And Glamorgan Council worked with them to support transport to the new health centre, along with Green Links. And they now have a demand responsive transport service that supports the patients to access the doctors. Many of these in all of these cases, the cost of taxis is not possible, even if a taxi exists in the areas that we're looking at. For example, Dinas Powys runs on a Saturday for flu jabs, those sorts of things, which ultimately stop people accessing the NHS and keep communities well and healthy. So as you can see, each one is based around councillors or councils coming together and working proactively with others to find solutions or find ways forward. There may not always be a solution, but to discuss options. When communities have decent transport, you have a greater sense of community. You know, the number of people that say they have been alone and they get on the bus and they sit next to somebody and they have a chat, and it is so powerful for them that they have that sense of community, that people know who they are. It might often be the only person they speak to that week. Often they don't really want to go anywhere. They'd be quite happy to potter around on the bus all day and just talk to people. And that's really important, that we understand that transport has such a negative, lack of transport has such a negative effect on people when they can't get out. It's so isolating. Economic uplift. So, if you have the ability to get people into your village, you can begin to run lunch clubs, classes, all these things that keep a village and community thriving can begin to come back if they don't exist already. And there's a real sense of well-being. Volunteers enjoy it. It gives a lot of it gives a lot to the community when you've got people supporting others in their community. And often those that have been supported will then go on to support others. So it really makes a difference. And by engaging with your communities, people feel heard. When I went to Newport, and I went to an event, and we were talking, and at the end, somebody came up to me and said, "I finally feel heard." And that was really important because they hadn't felt heard about their lack of transport. They had felt completely isolated and disregarded. So we need to ensure that councillors, councils, representatives, other third sector organisations listen and hear. And you may not always be able to solve it, but you can at least enable people to talk about why they're feeling as they are and how transport is impacting their lives. We particularly see it around access to work. Now, often this is called negatives, but I'm not going to call it negatives. I'm going to call it learning. Councils need to engage at all levels. So you need to use the structures that you have in place to ensure that you work well and you work well with your communities. You will hear from Rod that demand exceeds supply. We do not have enough community transport operators, drivers, vehicles in our communities to enable everyone to travel in the way that we would expect. So we cannot offer everyone inclusive and supportive transport at this time. There is just a high level of demand. Funding is needed. Even tiny bits of funding are really important. All operators want the 500,000. That enables them to be sustainable. But any funding that you have that could support an operator to do Christmas wellbeing trips, summer outings, support young people in schools, perhaps to do swimming. The costs for that are quite low, but they are significant when they are given to those groups. Particularly the schools who cannot afford transport and parents cannot afford to pay for transport. A local council saying we will fund, every year group to have their summer day out on the community minibus means every child gets to experience that. And it's something that we would expect all children to be able to experience, as it really does support their education and it makes them have fun. And that's really important. It's really important to have pilot projects, and they don't always work. And sometimes it can be very difficult to understand why, but sometimes it just isn't the right time or it isn't the right group. And it is important to learn why these may not work. And community engagement can be challenging. Who has the time to do that level of community engagement? It takes money to do decent and, proactive community engagement. These are all challenges that can be faced when looking at how to develop community transport. Working closely with partners really makes a difference. And sometimes it can be hard to identify who your partner should be. So it's important to look at who in your community can help you and who is prepared to step up, and forge good links with them. It may not be today that you need them, but it may be next year or the next 5 years. But have good, strong links with those in the community that you might need in the future. Community transport is a lifeline. We know it's a lifeline. We know that it stops people. The words isolation and loneliness are really bandied about. I see them a lot and they lose their meaning. And I find that quite difficult when I'm talking in things like this, because when we talk about isolation and loneliness, that is deep rooted in our communities. When people do not have access to transport, they literally live on their own. And it can really make people feel as if they are not part of the community. They don't deserve to be part of the community because they can't access anything. And this shouldn't exist in Wales. We want a stronger, healthier Wales, and part of that is enabling people to have the transport that they deserve. When you're thinking about what you could do, just start having conversations. Just ask, is transport an issue for you? What would you use if we had it in our community? How would you use it? Where would you like to go? Really think about the simple questions that you could ask. And also, what resources do you have to support that? How can you enable people to begin the process of community transport? And it doesn't have to be big. It can be very, very small. It can be one vehicle, 5 volunteers, and that can be enough for a community. Or it can be a fleet of minibuses, like Rod has, going around various communities. So think about what you need and have these conversations. You have the power in your communities to make a difference. And you have a lot of people who can support you to do that. CTA is one, but we also have this massive and thriving network of community transport operators across Wales who are always happy to share their knowledge and experience of how they've worked. The future is bright. We are a thriving sector. We are working with communities on the ground. We work with Welsh Government, Transport for Wales, and we continue to amplify the voices of our passengers, because at the heart of everything we do is our passenger. As long as we hear the passenger and what they need, then we will always do the right thing. What we deliver in Wales is innovative and it is always done with good practice. And we see the numbers of people using CT grow, and we want to make sure that operators are able to support them as we move forward, not just for the next year, but for the next 5 years and the next 10 years. We want to have a CT sector that really meets the needs of the communities, and that we have the support from everyone in that community to make it work. So thank you very much, Diolch yn fawr, for your time today. If anyone has any questions, then please, you can always get in touch with me afterwards. I'm more than happy to have conversations with you.
We do have a couple of questions for you in the chat, Emma, if you wouldn't mind just answering those for us. So one of the questions we have here from Conway Hawkins, he asks, do you have any examples of community transport schemes which work well for young people? Those that I'm aware of don't operate after school or on weekends.
I'd like to say I have every single operator working with young people, but we don't. Partly that is to do with the way that operators work. It's often 9 till 5. But yes, we have supported gig buddies in North Wales with some funding to support them with access to gigs, etc. Some of our operators do work with schools and young people. Wheels to Work is specifically really for those of 16 to 24, and that works really well. The flexi service does support younger people, but it does have slight issues around it. But I do know that a significant number of young people do use the flexi service, and that has been quite successful in that demographic. But I would agree we have work to do, and we also have work to do around enabling people to go to things like the cinema, theatre, that sort of thing in the evenings. I will admit that is an issue, but it's something that we do talk to operators about, and I think there is change, and we have worked with the Youth Parliament around. I worked with the Youth Parliament last year around looking at their transport survey as well. So we are looking at it, but it's not quite as I would like.
Oh, thanks for that, Emma. We have another question from David Robinson, and he says, we have a TFW bus service serving three small communities, T3C. This has replaced the T3 service, which previously connected these three villages, which ran 7 days a week. The T3C does not run on Sundays and bank holidays. However, the connections now provided between T3C and T3 are not always reliable. If the connection is missed, it's a 2-hour wait. As a chair of one of the three communities, I have considered undertaking and a transport survey to determine how the T3 service is actually serving the three villages, and would appreciate some guidance.
Yeah, that's absolutely fine. If you, I'm sure Angela will pass my email details around. We can certainly support you with the looking at what a transport survey should have, the questions you should ask, how to deliver that, and then to help you assess what options might be best for the three communities. It is something we are seeing. These connections are becoming a real issue as bus services are withdrawn. So it's not unique, and it is a very difficult situation to solve in some ways. But once we understand where people are trying to get to when, we can then look at what the options are. So absolutely more than happy to have a conversation.
That's absolutely fine. So I will pass those details on to you, Dave. So we have another question here from Clive Easton, and he asks, non-disabled community transport requirements. Do you have any pilot examples?
Non-disabled.
Yeah.
Okay. Most of our transport is inclusive. So most of our vehicles are wheelchair accessible, as standard. So that's what we would expect in our communities, that they all have wheelchair accessible vehicles. But those that are not would be things like volunteer-led car schemes, where a volunteer drives their own car. They are more, I don't think I know of any actually that are wheelchair accessible because of the rules around motability vehicles. But those are the ones that are least likely to be accessible. But we would expect all our operators to have wheelchair accessible vehicles as standard, because community transport has to be inclusive.
Brilliant. Thanks, Emma. And then we have a comment from Clanturd, and it says many young people don't even know that CT is available to them, which is, I'm sure, something you hear all the time, Emma.
Yeah, and it's an interesting thing, actually. And it might be that this kind of forum is how we support that conversation. Because I think I agree with you. CT has at its core a thought process that it's for old people or disabled people. But it isn't really. Some of our operators do have that as their kind of operating remit. But really, it is for young people as well. And I think it is highlighted young people often, and it's obviously come up twice today. And there might be a piece of work to do around how do we engage with younger people? Is that Instagram? It's certainly not Facebook these days, because I don't think young people use Facebook. That's for the old people like myself. And I think, if I'm honest, that is one of the issues we need to face as a sector, is that often those that run community transport are older. And so when we're talking about hearing people, actually, we probably don't hear from younger people in the way that we should. So how many of our organisations have younger people as trustees, for example? That would be really important. How do we encourage younger people to step into those spaces so that they can influence what community transport does? So yes, I fully take on board the young people, and I think there is work to do. It's not that we don't look at it, it's just it has particular issues that I'm not sure we're getting quite right. And it might be that we have to work with groups and organisations to see how we can change that.
Lovely, thank you. So we have another comment from Councillor Jerry Wellens. He says, I'm concerned that we can make progress on a rural CT scheme, North Wales/Wrexham, which will be overtaken by the WG review of rural transport, which is ongoing and may deliver a solution for us separately. So any thoughts on that, Emma?
Well, that's quite a difficult one because I can't anticipate what will happen. So I think you have to look at the needs of the community now. But I think communities are taking ownership of the transport because they cannot wait to see what bus services, etc., are going to be either put in place or withdrawn. So no, I don't have a solution for that. I think if your community is in need, then you probably need to begin to think about other solutions. And if we could anticipate what Transport for Wales and Welsh Government are going to do about bus services, then I would be able to sell that for quite a lot of money, I think, because that is kind of something that we would all like to know. But unfortunately, we don't know what the situation will be in the coming years around public transport. So if you are identifying need, then I would begin to look at solutions yourself now.
That's great. Thanks, Emma. Mike Cuddy asks, do you work with the health boards?
Yes, we do. We have a Transport to Health project that is supported by Anara and Bevan, where Anara and Bevan give us funding every year to give out to operators within the Anara and Bevan region to support Transport to Health. In West Wales, we run a health board forum where we found engaging with the health board really important because there's a lot of misinformation out there. And sometimes having direct access to the health board for operators can be really important. The work in Penturk has been with the health board as well, which has been really interesting to have their perspective. And in North Wales, my colleague Michelle continues to try and work with the health boards. But I will say it's very, health boards are complex things. Trying to find the right person to talk to and that person will be consistent for some time can be quite difficult. So you can start conversations and then they either leave or move on. We are also having conversations with WAST, which have been quite successful, and looking at the procurement process for operators on the 365 system and how we can change that because it doesn't work for operators to deliver better services for patients. So yes, we have some very successful opportunities with health boards, and those that we don't have such successful engagements with, we continue to speak to as much as we can.
Oh, that's great, Emma. We have one more question. Oh, it's not a question, it's a comment from someone who said we had an evening working with YEPS and invited 40 young people from the local high school. They bribed them with pizza and asked their opinions, and it worked really well. So there's a suggestion out there for anyone who's maybe struggling engaging with the young ones.
It was very interesting to hear what you said about pilot schemes, and indeed that would be very necessary because there could be lots of ideas and not all of them will necessarily work. I've been lucky enough to travel all over the world and see different transport systems, and one which I've witnessed in several countries, which seemed to work very well, but obviously would have to start off at a lower level to start with. And that is where people are picked up from low density areas and taken to a high density shopping or entertainment areas by a minibus. But the principle how it worked was that you did pay for your seat, but and it would pick people up individually in the low density areas, and then when they get to the high density destination, that transport would remain there and not leave until everyone had got back to it to be returned to their homes. And it just seems to me that that is a sort of scheme where you could sort of dip your toes into the shallow end of the pool to see how that could be made to work. It would obviously depend on the different communities involved and the distances to the nearest town, etc. But it would have more of a self-funding function because you are paying. But the cost of the paying for a seat would, in the long run, not equate to the extra costs of running a car, parking, etc., etc. So I'm really wondering whether we could start to investigate a scheme like that.
Well, you will, Clyde, that's really interesting. You will hear from Dave, which is effectively this is what they're doing. We have a significant number of our operators who effectively do that. So they go around and pick people up, take them to a town centre, wait for them, and then take them all home. They might take them to a supermarket, you know, and they wait there and then pick them all back and drop them all home. So that is effectively what a dial-a-ride service is. And this is when we come back to keeping communities thriving, is enabling people to access shops and things. You know, we've heard in Ceredigion in particular, with the withdrawal from the Booker bus, that there was significant concern that shops would close because people could no longer get into those centres to use them. So it's an important part. But yes, a number of our operators do that and will do, you know, demand responsive transport or a bookable service where you effectively book a seat. It is important to say that transport is 99%, it's not free. You do have to pay to use community transport, but it's always covers the costs only, so it doesn't make a profit. So it's a lot cheaper than a taxi, or as you say, a car and parking, for example. But yes, it is a good pilot model.
Our next speaker is Rod Bowen from Dolen Teifi, and I'm sure he'll expand on a lot of the presentation that Emma's made already. Thanks, Rod.
Thank you very much, Angela. I'm Rod, and I work for Llanfair Pontwelly Ymlaen Cove, and this presentation is going to be about rural transport solutions, the solutions we've got running in Ceredigion and Carmarthenshire, and some of the pilots that we've been doing over the last few years. So who are we then? We are Dolen Teifi, part of Llanfair Pontwelly family of organisations. Llanfair Pontwelly is a mentor group set up in 1979, and it supports a wide range of activities in the Llanfair Pontwelly area. We're based in Ceredigion, at the very south of Ceredigion, right on the border with Carmarthenshire, so we're quite well placed, you know, from a perspective of rurality in a sense. We're a brand partner of that organisation, so that's what we like to actually see ourselves. So we support the development and management of a wide range of transport solution in co-producing and partnerships throughout Ceredigion and Carmarthenshire. But we're a very small organisation in comparison, and development is not our skill set, but that we are finding ourselves having to actually do a little bit more than we used to. What do we do? Well, we operate 30 vehicles currently at the moment, set to probably increase by another 3 this year and probably another 10 next year, such as the demand for community-based type transport. Of those vehicles that we currently operate, 19 of them are minibuses. And 2 of those minibuses, they're 17-seat minibuses, by the way, are fully electric. 11 of the vehicles are MPVs. You probably see that in the top right, and they 9 of them would be fully electric. We operate under the Section 19 permit. It's a not-for-profit permit, and we offer a range of bikes as well, electric bikes predominantly, EV bikes, and they're both EV and cargo. And I'll mention a small bit about that in a couple of slides from now. We were set up back in 2006 as Dolen Teifi after some work we did with Welsh Government and Carmarthenshire County Council when they were trying to establish the now defunct Bookabus scheme. Bookabus worked reasonably well during the years, but the high costs of operating Bookabus and indeed subsequently the Flexi saw its demise at the end of last year. So we started our journey with one vehicle in 2006, and it was for group use. Any non-for-profit group in the Ceredigion, just over the border, Carmarthenshire area, that wanted to use our vehicle. We do a bit of hybrid car club where a family member will have a member of their family or a friend, close friend, that's got accessible issues, where they'll borrow our vehicle, our smaller vehicle normally, and volunteer to drive somebody to a health appointment, out for the day or whatever. It's about basically giving them the apparatus to get them about. So that's what we do. So just to cap on that, travel solutions for individuals and small groups to health and social activities. So where do we operate our vehicles? Well, in a way, I suppose Dolen Teifi are quite unique in the way that we developed our services. We've developed our services and co-produced our services with organisations, community councils, and the general public in different areas. So for instance, we've got a bus up in the far north in Borth, which we operate with the family centre, Aberystwyth with a church group. And by the way, all these vehicles that I mentioned, locations, will have multiple use from multiple types of organisations, from youth groups all the way up to elderly, dementia groups, mental health, and many, many other football clubs and so on, scouts. Cardigan, Llandysul, Brechfa, Carmarthen, Crosshands, Kidwelly, and so on. And there's 3 locations in Llanelli, Lampeter, Ammanford, and we have had a bus in Aberporth, but it's mostly serviced these days from the Llandysul area and Crymych. And basically what we've done is placed vehicles in those areas that are more suitable for the types of use that's been identified in those areas. So for instance, Llanelli, we'll have 7 vehicles in Llanelli, of which 2 are fully electric minibuses. Of the rest of them are diesel vehicles and 2 smaller people carriers. So they're there for a wide range of uses. And when somebody mentioned about youth, we do exceptionally a lot with youth organisations, from youth clubs down to charities help young carers and the scouts and many, many others. So about 40% of our clients or people that we provide our bus services for will be classed as youth. So some of our services then, we've evolved. Nothing's off the table as long as it's within the flavour of community transport. We do a considerable amount of one-to-one transport, taking people to health-related journeys, taking them to hospital appointments and so on, where we have a volunteer driver that'll take them, pick them up, take them to Bronglais, Prince Philip, Morriston hospitals, or whatever they may need to go on a one-to-one basis. And what we're finding these days that the Welsh Ambulance Service is not and has never provided an assistant with a trip with somebody going to an eye clinic, and we're taking more and more people now with their partner or somebody as a friend to the clinic so that they can get the treatment, but get this, more importantly, the support whilst they're in the hospital or in the clinic. We do EV cargo bike loan. Cargo bikes, I'll mention them in a small bit, and they're loaned to people within their community to get to work, for exercise, and also for moving loads of around. Maybe, for instance, we work with the botanical gardens where they've got staff cycling up and down between the 2 sites with cargo. We do a considerable amount for the mental health sector, transporting for mental health groups such as Mind, Links, dementia groups. We also provide our own Midas training. The Community Transport Association are the main holders of the Midas training. It's the gold standard of training, and basically we train all of our drivers to the Midas standard. brings us a small bit of income, but it also gives us the opportunity to deliver free training when that's needed. We do 2 dialer rides currently at the moment, and it is quite interesting to hear the gentleman say about taking people to services. A dialer ride service is exactly what it is. It's basically a service that somebody will ring and we pick them from outside their home and take them to services. We're expanding that from 2 this year to 8 by the end of the year. So there'll be an additional 6 new services being created in Clydogau and Carmarthenshire. And we do a considerable amount of not-for-profit group transport. That's basically anything from a school for extracurricular activities down to scouts, YFCs, dementia groups, a group like such as the WI or whatever, any non-for-profit group. And they normally provide their own trained driver, because we would have trained them or we've got a small pool of volunteer drivers. I'll mention volunteer drivers in a little bit. Some of our partner sites. Carmarthenshire Leisure Centre, we've got a vehicle in Carmarthenshire, and it's in conjunction with Carmarthenshire County Council and the Leisure Centre, the school and the community groups in that area. Carmarthenshire Leisure provide us with the site to keep the vehicle. We've got key handling facilities 24/7 at site, and the communities in and around and organisations in and around Carmarthen utilise that vehicle. Young farmers, youth clubs, and many others. Brechford Church Hall, that's a small community outside Carmarthenshire near Nantgaredig, and we've got a small EV people carrier there, and it's in a partnership we've developed with Brechford Church Hall and ourselves, where we've got an electric vehicle on site, it's there 24/7, and we've got a charge point on site which they host, and I'll mention a small bit about charge points in a bit. Railway Goods Shed in Llanelli. It's a partnership between the Railway Goods Shed ourselves, where we host 2 electric minibuses and we have a charge point on site. 4CG League of Friends in Cardigan, where the League of Friends came to us asking us for a solution to the problem of getting people in and around the Cardigan area to hospital appointments that they were providing at the new Integrated Care Centre. And we're working with 4CG and the League of Friends on delivering that. Cariad T. Dyffryn Ammerford. Cariad is basically a housing association. We've worked extensively with them in placing vehicles at their sites. It's quite strange, really. You put sheltered accommodation, independent living accommodations far away from services, and far away from services could be just a mile. And basically getting then to your Tesco's or just getting out for the day can be difficult. So basically, by working with Cariad, they've got a vehicle on site, they've got volunteer drivers on site, and the community around the T. Dyffryn site gets use of the vehicle as well. And also we're working quite extensively with Llanelli Town Council. They provide a site for us at the Selwyn Samuel Centre in Llanelli, where we've got 2 charge points, so we keep 2 vehicles. And as a result of that, the Selwyn Centre have got access to vehicles and numerous other organisations, such as schools and youth groups and older people's groups, such as some of the older people residential homes have got access to a vehicle and volunteer drivers. And that's just a small example of the type of partnerships we've got. So we operate this with 6 members of staff, 2 full-time, everybody else is part-time. To maintain our fleet of vehicles, we've had to use technology, because if you can just imagine, if you've got a vehicle up in Borth, one down in Llanelli, making sure that you're getting all the books out of it and getting all the feedback from the vehicles is difficult. So we use GPS real-time tracking. It helps us with tracking the performance of the driver, tracking the mileage that the driver may have done, and it works as an audit tool for us as well. And we're trialing at the moment an online version of a walk-around book. It's a compliance book, which every driver has got to do before they take the vehicle out, whether it's a small people carrier or a minibus. But we also rely on excellent driver feedback, volunteer driver feedback, and we've got a really good group of volunteer drivers, which I'll mention in a bit. We've just commissioned a booking and calendar system with an online booking facility. You'll be shocked and surprised, or not surprised, that we get all our bookings with various means, through various means, from messenger to texts to emails and to phone calls. So we've had to adapt and adopt different ways of actually collating that information, and the new booking system allows for that to happen. And you can imagine organising 30 vehicles on a daily basis can be quite a headache, so we need a really good calendar booking system. And we've just started a text-based volunteer job software, which basically means that we now text a group of drivers, maybe in Borth, or maybe in Aberystwyth, or in Llanelli, when a job comes in, when a group of people that are hiring the vehicle haven't got a driver. And it just will streamline our time in the office. We're unique in the fact that for whatever reasons, we work 365 days of the year. So all of our services are available at 365 days of the year. We operate from 7 a.m. in the morning to 8 p.m. at night. And the reason for that is that through frustrations that I've had in the past existence with getting hold of vehicles and so on, most of the people that value our service value us actually answering the phone and giving them a solution, or telling them that we can't actually provide a solution to them. So it's about customer support and being it makes it much more easier for us to interact with our customer. Because say, for instance, a group in Swansea or wherever they are say to us they want to go on a trip on Friday. We haven't got a vehicle on Friday, and then we will negotiate with them. Maybe they go on Saturday or the Friday afterwards or whatever. So we try to optimize their options, but we also optimize the use of our vehicles. So 7 days a week, 365 days a year. And just to give you an example, we had last Christmas probably 10 vehicles out on self-drive, taking people from care homes back to the family home for Christmas dinner. How many passengers do we carry? Well, pre-COVID, we were having a pretty easy time of it, really. And during COVID, obviously, because of the restrictions, things cooled down considerably. Pre-COVID, we were carrying something in the region of 27,480 passengers per year. Of that, they came from about 1,460 vehicle movements or minibus bookings. This year is predicted on the trajectory we're currently on, well over 56,000 passengers, because we've got more vehicles and also more demand, but that will equate to around 7,000 bookings that'll come in as an individual. And part of the 7,000 bookings are the individual bookings, where we're taking lots more people to single health rated journeys. We're different from lots of organisations, especially in the community transport sector. We partner up with lots of different organisations, from Youth YAC, which is in Carmarthenshire, Young Adult Carers, the Pobl Group, Age Cymru Dyfed, Planed, Calves, Carmarthenshire Burns Foundation, Welsh Government. We've been doing some work for them recently, and Links Mental Health Charities, and the Health Board. And the reason for that is because we get lots of really valuable feedback from them as to how we may want to develop our services in the future. And it's partnership, and it's called co-production as well. So just to give you an example of where we are today, we audit all our activity now. We use an insight to actually check how many people we're carrying and so on a weekly basis. So currently at the moment then, on the weeks 3rd of June to the 9th of June, out of all the vehicles, we did 453 journeys, which were used by schools, medical appointments, many community groups, and single journeys. Covered 3,796 miles with all the vehicles. Volunteers gave up 379 volunteer hours during that week period. And when we audited the social impact, in a sense, 32% of the clients who contacted us declared they were living in rural isolation or with some form of disability. But rural isolation is not the only problem we've got in society today. We've got urban isolation as well, because there aren't the taxis maybe that are converted for fully accessible, or maybe the cost is prohibitive to some people to use them. And just a very, very quick map showing that some of our vehicles have been all the way up to Liverpool, Wrexham, Oswestry, and so on, down to Swansea, and wherever they tend to go, and some of those are multiple journeys over those routes. So we've taken a really innovative approach on volunteering. To date, we've got 792 active volunteers, because every organisation that uses our vehicles have got their own volunteers. There's just an odd few organisations that haven't. And the way we've achieved that is by working with these organisations in cultivating volunteers to come forward to drive for the organisation. It may be a husband, it may be a teacher, it may be an LSA, it could be anybody really, but saying that they will have, I would say 98% of all our activity with community vehicles will have somebody within a family or within the organisation that will volunteer to drive. We've provided all our training for volunteer drivers that come forward free of charge. There's a charge to us currently at the moment because of the new way that the Midas is delivered, but we've secured grants to mitigate that. And that is why we've got a large amount of volunteer drivers that are active. There are quite a few that are inactive. That figure is probably that we've trained over the last 6 years, probably nearer to 2,500. But having 792 active volunteer drivers really makes a difference to us, because basically it just makes our lives so much easier. And over the last 12 months, when we look at the contribution of volunteers have put towards driving, volunteering, they've put in, quite a magnificent 18,644 hours over the last 12 months. Community transport has a very positive impact on community lives. We find that on a very regular basis. Our drivers are helpful, flexible, and also very friendly. So just to give you some examples of what we're doing currently at the moment: GP appointment, blood test, practice nurses. We take lots of people to the local surgeries and so on. We take people to shopping on a weekly basis, attending social groups, attending dental optician appointments, eye clinics and so on. Getting to this train station. We've got people that just take somebody to the train station. Meeting public bus services. Since the cuts in Booker Bus, that work has escalated threefold. So we take people first thing in the morning at maybe 7 o'clock in the morning to meet the public bus service, and then we bring them back at about 5 o'clock at night, depending on when they need to return. We do lots of youth service and activities and extracurricular school activities. So let's go on to the cargo bikes, and I promised to mention a small bit about it. We've got 14 EV bikes, all of which are out with the general public at the moment, from being used for exercise, accessing services, getting to work, and also recovery from medical procedures. We've got a gentleman in Buryport. He's got it because he just had a stent fitted and he wanted to get more active by cycling around the coastal path. And an electric bike, if anybody's used one or have got one, is an exceptionally easy device to drive, or ride rather, but the strain on it is a lot less than pedaling a non-powered bike. 8 cargo bikes. There's a picture on the bottom there with a chap from Cardy Shed in Cardigan who's using it for the Cardy Shed activities. He's got 2 bikes as well. And we've got the Botanical Gardens then using 2 of our cargo bikes for moving equipment from and stuff around their quite large site, carrying and delivering goods. And we've got a waiting list to use the bikes. Electric vehicles. Well, we've invested heavily, or maybe government and lottery have invested heavily through grant into electric vehicles. We saw the opportunity of electric vehicles as being an opportunity to mobilize our communities. So when others may have looked at electric vehicles, it's a bit early to actually start getting involved with them. We saw it as an opportunity to bring vehicles into our communities and also utilize them within our communities to take people to whatever services and they needed. So we brought the investment for the good of the people. They have an excellent range and are very durable. They work exceptionally well for us, but they also keep our operating costs down. We control and have installed 28 EV charge points. The charge points are needed in these rural locations where we keep the vehicle, because basically, if you think about it, if you volunteered to take a vehicle out and you utilized most of the energy in that vehicle before you brought it back, you wouldn't want to be waiting there for 3 hours or 4 hours for it to charge up before before leaving the site. So what happens is the vehicle will go out, it'll basically be used, they'd use 50%, 25% or 100% of the energy, and they'd leave it overnight then for it to be charged. We also have FRD cards in it where they can be charged if a person is going on a longer journey. So we had one of the electric vehicles last week in London, but they would have stopped probably twice on the motorway to get to London and charge the vehicle up. Our operating costs for a vehicle that's electric is about a third of what we'd probably find for a diesel powered vehicle. Maintenance is cheaper and electric is cheaper. And the reason we get cheaper electric is because basically by putting these charge points into rural locations, we have a charge point that we are charged for the electric at the cost that the organisation is paying for it. So for instance, most of your public charge points these days would be about 69 to £1 per kilowatt hour. We are actually only being charged 35 pence per kilowatt hour for the fuel that we're putting into the vehicles. So it's brought our operating costs down, but in rural communities, there's more charge points because basically they wouldn't have normally been installed in those areas that we've got the charge points. And from our perspective, if the location where we've installed the charge point for our vehicle wants to charge the general public for using it, they're able to, but we then pay them the profit they make from that back as a gratitude to them for having the charge point at the location. So just to give you some examples, really, we look at how community transport can have a positive impact. And this is just one of many, or two of many that we have. A father and daughter from, I can't see the slide properly now, for some reason. Hang on, I'll just get it up on this one. So that I relay exactly what I'm seeing to you. Bear me 1 second. Nearly there. From Llanfair, daughter from Cardiff. The daughter volunteers as a driver for her father. They don't have access to a mobility car, and she uses the breakfast car to transport her father out for the day. And she does that on a regular basis. Sometimes she borrows for 3 days, sometimes she borrows for a day, or just to take her father to a particular appointment that he may have. And recently we helped a lady near Carmarthen, it was, who was 80 in a care home with reduced means and with a disability that had affected her mobility. She could not get into a car, but her husband had passed away and didn't know how to get to his funeral. Anxiety and worry, thinking that she would not be able to attend the funeral, and we were able to help her by working with the funeral director and using a volunteer, and the Dolen Teifi car took her to the funeral and back to the wake thereafter. So that's basically the conclusion of the slides. And these are some of the partners that we've worked with and continue to work with currently. There have been success stories, numerous success stories, but there have also been failures as well. And during COVID, we were really struggling with the amount of vehicles we had in knowing when the restrictions came in as to what the future really held. So we started piloting different things, and we started piloting different ways of working with community councils and also with other organisations. And what was quite obvious to me was that there were some community councils, especially in the west of Carmarthenshire, that were quite interested in looking at the community transport needs in the area, but also supporting some of the activity financially as well by underwriting some of the costs that may have been incurred if a vehicle had been put into the community. And one of the communities was a small community in Llanfair near Whitland. Did quite a lot of work with them just during COVID and just coming out of COVID, but they had offered £1,500 a year to underwrite the scheme, but we were waiting for the community hall to give approval for an electric charge point on site. But the demand for our vehicles became so great, we just weren't able to progress that pilot. And my promise to them is that I will go back there once we get some finance to move our project forward. Now, we're working on different grant pots at the moment, and we're working with different community councillors, and we are working with different communities. And as I said at the beginning, we hope to actually place another 12 vehicles within our communities in the next 6 to 8 months. So we're not stopping at where we're at. The demand is so great that we really need to actually continue to invest and provide services that are meaningful to our communities.
Over today,
So
Bartholomew now from Llanfair, Clydogau and Cellan Community Council, who will be talking about their community transport scheme. Thanks, Dave.
Okay, thank you very much, and interested to listen to the presentation so far. Okay, right. So we're a small community council representing 2 villages, and what we'd like to do today is really just present quite quickly some reflections on our experience of working with the community and starting a community transport group. My presentation starts by looking at some context, and the context starts with a problem. How can we as a community council help to rebuild communities after COVID in a post-COVID economy? So there were 2 areas of context here. The first is the challenge to the community. How do they start rebuilding after lockdown, where we've all got used to never being closer than 2 meters to anybody and they were wearing a mask? How do we start to re-establish that connection? During COVID, the village pub closed. And the village pub was a hub of community activity. Essentially, when the village pub closed, after COVID, things stopped happening because people stopped meeting each other. They stopped being able to go to that environment. And that led to a greater fragmentation of the community. That seemed to extend as the community was threatened with being fragmented from other communities by the potential closure of the bus service. Now, let me just state the bus service was not going to be closed per se, but the route was going to be modified, and our village wasn't necessarily going to be on it anymore, which amounts really to the same thing. The service was retained, but there was no weekend service and nothing after 5 o'clock, so it was much reduced. The council also had some challenges at the time. In the elections in 2022, only 2 out of the 10 members restood. 8 took that opportunity to resign. And we actually started that year with 4 members, which was 6 below where we had been. The clerk also resigned. When the councillors resigned, we had limited access to our bank account because the signatories went, and it took a while to resolve that problem. And our website developer moved and would no longer support the website. Historically, the interaction that we had with our communities had been low. There's a wonderful quote that I love. It says, if you change the way you look at things, the things you look at change. If you reformat the problem, it can become an opportunity. Yeah, how can we now rebuild to become a force in our community? I won't labour the slide, but what we wanted to do was extend our constituency. We wanted to use the new blood. Change was part of our problem. So let's make it part of the solution. Let's embrace change. How can we change? What can we do? And we wanted to re-engage with the community. So we wanted to reorient and refocus. Historically, we'd been very good at filling grip bins and reviewing planning applications. But going forward, could we take this opportunity to rebuild? I don't think we articulated it then, but looking back when I put the slide together, we actually operated in 3 steps. We started by communicating. We had to develop a new website and we had to take on a new clerk. So the clerk that we took on, we ensured this time was bilingual. We'd never been able to communicate in English and Welsh before. And we started to go out into the community as well to try and identify what sort of things were needed. Look for opportunities, not just to preserve what was there, but to see whether we could add value and create new opportunities to improve the community. And then the third step was to empower. We wanted to be able to support the community, but we didn't really want to actually do it for them. So we wanted to be able to work with areas of the community on projects that they were interested in. So our solution, I say solution, it's actually the start of a solution for the community council, and it's the solution to one of the problems for the community itself, the community bus. I'm just going to extend the context here. There's a question, how do we start from scratch? So I'll try and give you a condensed timetable of events. In November 2022, we got a letter or an email from one of our community members asking us about the challenges, the cuts in funding and the reduction of service of the bus. They were quite concerned. We decided to try and investigate that a little more. So we sent a letter to the county council. It was a request for information under the Freedom of Information Act, because the county council had justified this by saying there were reduced numbers and therefore it wasn't feasible to run the service. So we asked what were the pre-COVID and post-COVID numbers of passengers. The response we got wasn't helpful. It was essentially, we don't hold the information, it's held by a third party, full stop. Maybe we should have gone back on that email, but we had some other problems that we were dealing with. What we chose to do instead was, two of us went to the local community action group that was forming to sit in, to listen, to watch, to try and understand what their concerns were and why, and whether there was anything we as a community council could do to help. We took that back to the council. We decided that this was an area that we should be engaging in. It was a perfect opportunity to, if you like, rebuild our brand. What we didn't want to do was to become a bus service operator. We wanted to support the community if they decided to take that forward in whatever way they decided to take it forward. The community did decide, when the new reduced service came through, that we needed to address, or they needed to address, the Saturday service. Now, at this time, I was the liaison officer, if you like, between the community council and the bus group, and I attended most of their meetings. I listened, made notes, reported back. I contributed in terms of the discussion, but I never took part in any of the votes. This was very much their decision, how they wanted to go forward. They wanted to investigate the idea of the community bus. Our local county councillor, who also became involved and attended the meetings, had already met with Rod a couple of months earlier. And she brought to us this proposition. Why don't you just talk to him? So we did. And from that, Rod very generously made us an offer for a bus, which we could place into our community. We needed to run it. There was a single cost operating fee so that we could figure out costs going forward. What we did then was to try and figure out a route. We have 2 villages and Llanfair, the local town. We worked on a circular route, which would go one side of the valley to one village, come down the other side of the valley through the other village and go to Llanfair. We decided to run that 5 times on a Saturday. Okay, so we could take people in and out with a late evening service as well. Our next problem was trying to identify some drivers. So we looked out to the community to see whether we could get some volunteer drivers. We identified that there were some people, and we managed to pull in 6 volunteer drivers. We applied to CAVA for funding, and they initially came back. It was a £1,000 grant and offered us £500, but on a matched funding fee. We wanted to know more about that, so we met with them and we asked whether that could include our time. But no, it couldn't. It had to be matched financial funding. They were also asking a lot of questions to justify the service. And we tried to point out that actually we were running this as a pilot. We didn't know what the demand was or what the demand would be. We didn't know exactly how the service should be run because we'd never done that sort of thing before. What we wanted to do was run a 6-month pilot to try and establish our understanding of what we could offer and what the need was. So we couldn't answer those questions. CAVA come back and they said that they would give us the £500, but then they imposed further conditions, which they hadn't mentioned before. The bus group met, decided to reject the conditions and reject the offer. I took that back to the community council. They agreed. They rejected the conditions and rejected the offer. The community council offered to part fund the £500 in match funding, and Catalan Village Hall Improvement Society funded the rest. So we had £500. We'd already started to think about a service. We were going to launch it on the late night opening for Christmas shopping in Llanfair on the 30th of November. We were 2 weeks away. Ellen Jones was coming down to ride the first bus. Clonk had been contacted and were coming to cover it, as were the Cambrian News. We had to make a decision. Do we pull the plug or do we go forward? We decided to go forward, but we needed more money because the £500 would only, even at the costings that we got, take us through to the end of January, maybe the middle of February. So we thought, and somebody had the idea to crowdfund. I have to admit, I was skeptical. We set a target of £250. We reached that about midday on the second day, and we raised 750. So now we actually had more money than the grant, and we could comfortably run our pilot for the 6 months we wanted to. 6 months was key to us. We wanted to cover 3 seasons to see whether there was a difference in when people would use the bus, how it would be affected by the weather. I have to admit, for the 3 seasons thing, the weather recently has not been on our side, but we have been able to carry that through for the 6 months. We want to be able to offer the service free at the point of use to the users for the Saturday service. It's not there to make a profit. It's there to provide a service to those who need it. But we need to be self-sustaining. So the next thing is, okay, how do we continue? How do we raise more money? There are really 3 ways we could do this. We could try and stay an organisation that charged nothing and rely purely on the generosity of funders. We could look at a fully chargeable service, but then we didn't feel that that suited the needs of our particular community. There are a lot of elderly, most of them are on bus passes. Why would they want to pay for a service? And anyway, to actually have a point of payment on the bus would actually present us with some technical difficulties, cash, card, etc. And remember, we have volunteer bus drivers. The third model is partial funding. And that was the model that we wanted to explore. What we wanted to be able to do was offer this primary based service, continue that through, free at the point of use on the Saturday, but then to use the bus to be able to offer 2 groups for a fee to support outings or other trips that they want to make. Our problem was that that is a little difficult model when you've only got 6 volunteer drivers. Yeah, we did consider a book a bus type scheme, but for the same reason, did we have enough volunteer drivers to cover a continuous operation book a bus? Another grant came up, Community Cohesion Small Fund grant. We've applied for that. Again, it's £1,000. And we've applied for that on the basis of running a pilot. We've worked out a number of places that we can go, 12 trips over 12 months, that we can advertise within the community, that we can then try and get people onto that bus and onto those trips. As we run this as a pilot, we'll understand again the demand, and we'll begin to understand a charging structure which would work. That is what we hope anyway. And we'll be able to take that through and look and really investigate this model of being able to be part public service and part funded model. We're also applying for a larger grant. We're starting to be involved in negotiation with other organisations, because in the short term, it's the grants which will keep us going until we can complete our pilots and move forward. The biggest problems we've had numbers of drivers. 6 is not enough. Our drivers do a half day every Saturday, so we need 2 per Saturday. Covering drivers who can't make it has always been a persistent problem. Funding is a persistent problem, but here we are 6 months later, and we're still here and we're moving forward. Hopefully that gives you an idea of where we've come from and where we are. We've recently set up as a charitable organisation, the Community Transport Group. I've moved on to chair that simply because there were only 4 people, and one of those is actually quite ill at the moment. And we needed 3 people to form the executive to be able to open the bank account and get the charitable status. So, in terms of the solution, what did we do as a community council? We started to liaise with the local bus action group, and we opened that communications channel. We provided assistance. We did not take the problem away from them. We provided assistance with the grant funding and then direct involvement. That was myself as the liaison officer and now as the chair of the group. And we've been able to form closer alliances with the community group and my representation on the committee. What did the community council get out of this? Well, it's ongoing, but we've started that process of understanding what our community needs and what we can do. We've identified a new opportunity, and we are continuing to identify more opportunities within the community where we feel that we can engage. And we fostered new links and relationships. I'm not going to read every single one of those, obviously, with Rod and Emma here, but also those relationships with the press, with parliamentary representatives. Those are important relationships to us to start to build as we go forward into the future. So what is the future? First question is, if we look back, what would we have done differently? And if I'm honest, not much, because we didn't have the tools, the know-how, or the knowledge. We literally took it step by step. And those steps have got us here today. And here today is actually a fairly positive position. We wouldn't have got here today without the support of Rod and without the support of Emma, but they've helped guide us. What would we do differently in the future? What can we use from our learning? Well, one part of that is to do more of what we started to do. Identify our engagement, listen to the community core. Figure out how we can effectively deploy who we are, our resources, and what we can do. The skills and the knowledge that we can give to the community. How we can help them apply for grants. How we can directly fund them from our precept. And how we can get involved, actual involvement, where individuals from the community council can work with community organisations. I suppose the key for us now is to evolve experimentally and to grow organically. I couldn't tell you what the future is, just that we're heading out there. I wanted to leave a couple of points. I'm not here to tell anybody how to run their community council, but just from our learning experience, I think there are 3 things which jump out at me. 3 things that councils can do. Think, how do you engage with the community? How does the community engage with you? Discover the local issues which are important. And these all seem disparate issues, but in some way they all relate to rural transport. Yeah, the funding cuts directly on the bus. NHS, not necessarily the delays, but access to NHS services. We can use our bus to help people access clinics, which would be difficult to get to. The one thing that we don't want to do is take on a bus service or take on a private taxi company. But we do want to be able to support vulnerable groups within the community and to enable them to be able to have access to the services which would be difficult for them to get to. So again, looking at inclusion, isolation, our current grant application and our current plans deal directly with that. To try and bring together the elderly and the young, the English and the Welsh. Yeah, to try and bring together families, all using that bus to go on trips together, to share experiences and to share stories. What else? I don't know. We keep looking. So what does the future look like? Oh, sorry. Last thing, identify what you can do. Those are 3 steps I think that we've learned. we can implement as a council. What does the future look like? Possibly quite bright. Yeah, and we'll continue to move forward into the future and look for those new opportunities. We were pushed for time. I hope I didn't speak too fast, and I will take any questions that you have. But right now, I'd like to thank you for your company and invite you to ask those questions. Or if you wish, you can visit our website where you can see some of the things we're engaged in, or you can contact our clerk directly. Thank you very much.
Minutes just to say I hope you found today's webinar interesting and useful. I'm sure there's been some great takeouts for all of you in this, and obviously there's the opportunity to follow up with questions too. I wanted to thank all of our guest speakers for their fantastic presentations today. So just lastly, just wanted to thank all our presenters on behalf of the team, Emma and Vanessa as well, and One Voice Wales. And thank you everyone for attending our webinar today. Hope you've enjoyed it, and we very much look forward to seeing you at our future webinars too. Thank you.